Cryptococcal antigen lateral flow assay.
The IMMY CrAg LFA is a simple-to-use dipstick developed to detect cryptococcal antigens in 10 minutes. The test has very high sensitivity and specificity. The CrAg LFA uses highly sensitive and specific anti-cryptococcal antibodies to the primary antigen shared by the cryptococcal organism. The test can aid in the diagnosis of cryptococcosis, which is one of the most common opportunistic infections in people living with HIV.
The IMMY CrAg LFA test kit contains the following reagents and materials: LF specimen diluent 6.5 milliliters, CrAg LF test strips 50 strips in desiccant vial, CrAg positive control 1 milliliter, package insert. Other materials required but not provided in the kit: pipette 40 microliter. Disposable pipettes of similar volumes can replace these. Gloves, timer, disposable microcentrifuge tubes, test tubes, or a microtiter plate. Sharp discard container. Biohazard disposable bags. Please note the following. All reagents included in the kit should be stored at between 2 and 30 degrees Celsius. The test and reagents must be used before the expiry date listed on the kit. Unused test strips should be returned immediately to the lateral flow test strip vial with a desiccant cap firmly attached. All reagents should be tightly capped immediately after use. Blood, serum, plasma, and CSF are the only approved samples for the IMMY CrAg LFA test. Today, we are going to be using serum as our test sample. To ensure optimal results when using serum, do not use hemolyzed serum. If the kit has been stored at or below 4 degrees Celsius, allow the kit to come to room temperature before opening. Use of this kit with samples other than human serum, plasma, CSF, and whole blood is not recommended. Testing hemolyzed serum samples could lead to false negatives due to the high background color on the strip. Set the pipette to 40 microliters, equivalent of 1 drop. Add 1 drop of specimen diluent to the tube. And gently tap the tube on the finger to ensure diluent reaches the bottom of the tube. Pipette 40 microliters of the specimen, CSF or serum, into the tube containing diluent. Remove the CrAg LFA strip from the desiccant tube and place in tube containing specimen. Set the timer for 10 minutes and allow the strip to incubate. When the timer is finished, remove strip and read results. Note: you can read the results 10 minutes to 2 hours after inserting the strips. If more than 2 hours have passed since running the test, please rerun the test. CrAg positive. The presence of the control and the test line, regardless of the intensity, indicates a positive result. CrAg negative. The presence of a single control line indicates a negative result. Invalid result. If the control line does not appear, the result is invalid and the test should be repeated. Note: the stability of the control and test lines beyond the reading time, 10 minutes to 2 hours, has not been validated. A negative result does not rule out the diagnosis of disease. The specimen could simply have been drawn before a detectable antigen was present. Dispose of all specimens and materials used to perform the test, including the used LFA test strips and materials used to wipe up spills, as though they are biohazardous waste. Follow all local regulations on biohazardous waste disposal when disposing of these materials.
Today, we have demonstrated how to qualitatively test for cryptococcal antigens using the CrAg LFA. This is a highly effective test for the diagnosis of cryptococcal infection. The test has several advantages. It can be used as a point-of-care test. It produces a result in 10 minutes, can be stored at room temperature, and is easy to use